Incorporate garlic into your diet, but be cautious of these 6 common errors, as they can have serious consequences. For centuries, this remarkable bulb has been regarded as a potent natural remedy. However, it's important to understand that it can become harmful if certain common errors are made in its use. Within the depths of historical medical literature, there are findings that suggest that improper consumption of garlic may lead to serious adverse reactions in the body. Recent studies indicate that a significant percentage of seniors may be making critical errors with garlic, errors that could potentially elevate liver stress by 47%, thin the blood to hazardous levels, or negate any benefits previously assumed. It is possible that the method of ingestion is incorrect, the cooking process is flawed, or there may be interactions with medications that could render it harmful. One study indicated that a single error diminished the effectiveness of a heart medication by 51%. That is not a myth. It is grounded in scientific evidence. It is important to recognize that certain natural remedies, such as garlic, have the potential to serve as alternatives to various medications when used appropriately. However, if misused, it may lead to severe consequences for your health. In this video, we will reveal 6 surprising garlic errors that often go unnoticed, yet are crucial for every senior to understand. Additionally, the second error could lead to gradual harm to your brain, often without your awareness. Before we explore these potentially life-saving insights, I would like to pose 2 questions to you. Have you ever noticed any unusual reactions following the consumption of garlic? Secondly, how do you prefer to prepare garlic? We are carefully reviewing and responding to all comments with tailored suggestions and guidance. Let us begin with the least concerning issue and progressively address the more serious mistakes that could lead to severe consequences. Error number 6 involves inadequate storage conditions. One of the less frequent yet still hazardous errors is the improper storage of garlic, especially when it is kept in oil. Chopping fresh garlic and placing it in oil at room temperature creates an ideal setting for the growth of Clostridium botulinum, the bacteria responsible for botulism. This anaerobic bacterium flourishes in environments devoid of oxygen, such as oil-covered garlic. A recent study featured in the Journal of Food Protection analyzed 48 instances of foodborne botulism associated with homemade garlic in oil preparations. The study indicated that storing at room temperature for merely 48 hours resulted in a 400% increase in toxin production. The concerning aspect is that botulinum toxin lacks both odor and taste, which means its presence may go unnoticed until symptoms manifest. The initial signs may be mild, presenting as blurred vision and dry mouth. However, within a span of 12 to 36 hours, you may experience the onset of paralysis, which can progress from your facial area down through the rest of your body. The toxin inhibits nerve signals to the muscles, and without prompt medical attention, respiratory failure may ensue. In the recorded instances, 23% necessitated mechanical ventilation. The answer is unexpectedly straightforward. To prepare garlic-infused oil safely, ensure it is stored in the refrigerator and consumed within 1 week for optimal freshness. Lower temperatures significantly inhibit the proliferation of bacteria. It is advisable to prepare small batches fresh as required. Commercial preparations are considered safe due to the presence of acids or preservatives that inhibit bacterial growth. Incorporating citric acid or lemon juice into your homemade preparation can effectively reduce the pH to below 4.6, establishing conditions that are inhospitable for botulinum. For optimal safety and advantages, consider utilizing this approach instead. Roast whole garlic cloves in olive oil at 300 degrees Fahrenheit for 45 minutes, then strain and refrigerate immediately. The application of heat effectively eliminates any existing bacteria, and the flavor profile of roasted garlic is notably more intricate and advantageous compared to its raw counterparts. Error number 5. Integrating garlic with diabetes treatments. As we progress along our risk assessment, we come across an error that impacts millions of individuals living with diabetes globally. Garlic has compounds that can naturally reduce blood sugar levels, which may seem advantageous until one considers the potential interactions with diabetes medications. A study conducted by the National Institute of Diabetes in India examined 146 individuals with type 2 diabetes who incorporated garlic supplements into their treatment regimen alongside their prescribed medications. The findings indicated that 31% of participants encountered hypoglycemic episodes, with blood sugar levels falling below 50 milligrams per deciliter, a level that is critically low. 9 individuals necessitated urgent hospitalization. The active compound allicin found in garlic has been shown to improve insulin sensitivity and facilitate glucose uptake by cells. When you are currently using metformin or insulin, incorporating large quantities of garlic can lead to an enhanced effect. A sudden drop in blood sugar levels can lead to confusion, seizures, or even loss of consciousness. Dr. Sarah Chen, an endocrinologist at Johns Hopkins, reported a case involving a patient who experienced severe hypoglycemia while consuming 4 cloves of raw garlic daily alongside metformin. His blood sugar fell to 38 milligrams per deciliter while he was asleep, and his wife discovered him unresponsive. Only the prompt administration of glucose was able to save his life. The adjustment involves not completely eliminating garlic, but rather focusing on timing and careful monitoring. For individuals managing diabetes, it is advisable to incorporate garlic into meals instead of taking it on an empty stomach to maximize its benefits. This delays absorption and helps avoid sudden decreases in blood sugar levels. Begin with a modest intake, such as 1 clove each day, and keep a close watch on your glucose levels over the course of 2 weeks. It is essential to communicate your garlic intake to your healthcare provider. Your medication dosage might require adjustment. Numerous individuals effectively integrate garlic into their regimen by slightly decreasing their medication with appropriate medical oversight. It is essential to implement a gradual approach and maintain ongoing observation. It is advisable to choose cooked garlic instead of raw, as the cooking process decreases the allicin content by approximately 40% while preserving other advantageous compounds. One common error is consuming raw garlic on an empty stomach. This error has resulted in numerous individuals seeking emergency care due to severe discomfort. Consuming raw garlic on an empty stomach can lead to serious complications if you suffer from ulcers, gastritis, or inflammatory bowel conditions. The sulfur compounds present in garlic, while beneficial for health, can also be quite irritating to already compromised digestive tissues. A study conducted by Seoul National University examined 89 patients diagnosed with stomach ulcers who included raw garlic in their diet. Among the individuals in the study, 42% encountered significant bleeding events, while 18% necessitated blood transfusions. The mechanism is strikingly straightforward. Allicin and various sulfur compounds enhance the production of stomach acid, while also causing irritation to the protective mucus layer. Dr. Michael Torres, a specialist in gastrointestinal health based in Miami, recounts his experience with a patient who consumed 3 raw garlic cloves each morning to enhance immune function. Unbeknownst to her, she was experiencing the onset of ulcers. One morning, she presented with acute stabbing pain accompanied by hematemesis. The garlic had caused significant damage to her ulcer, resulting in a perforation that necessitated emergency surgery. The inflammatory response extends beyond just the stomach. Individuals diagnosed with Crohn's disease or ulcerative colitis encounter comparable risks across their gastrointestinal system. Raw garlic can initiate inflammatory responses that may lead to significant flare-ups lasting for weeks. A documented case involved a 34-year-old man whose Crohn's disease had remained in remission for 2 years until he initiated a raw garlic regimen. Within 5 days, he required hospitalization due to intestinal bleeding. The approach necessitates thoughtful adjustments rather than complete removal. If you are experiencing any digestive issues, it is advisable to avoid consuming raw garlic on an empty stomach. It is advisable to consume it alongside food, ideally something alkaline such as milk or yogurt, which can help neutralize acidity. It is advisable to lightly cook your garlic, as this method decreases irritating compounds by 60% while maintaining the majority of its beneficial properties. Explore aged garlic extract as a potential option. The process of aging transforms harsh sulfur compounds into the milder S-acetylcysteine. Research indicates that aged garlic offers cardiovascular advantages while minimizing digestive discomfort. If you find it necessary to utilize fresh garlic, consider employing this technique. Finely chop 1 clove and combine it with a tablespoon of honey, then stir it into warm water until dissolved. The honey provides a soothing layer to your stomach, while the process of dilution helps to lower the concentration. Common error number 3: ingesting garlic prior to surgical procedures. This is where the situation becomes truly critical. Garlic has potent properties that can affect blood coagulation, and its consumption prior to surgical procedures may lead to excessive bleeding. Many individuals are unaware that something seemingly harmless like garlic bread can transform a standard procedure into a critical situation. A thorough analysis of 4,832 surgical cases involving patients who experienced excessive bleeding has been published in a reputable medical journal. In the analyzed cases, 8.7% were directly associated with garlic intake in the week leading up to the surgical procedure. The research indicated that individuals who ingested more than 2 cloves each day experienced an increase in bleeding times by as much as 250%. Dr. Jennifer Park, an anesthesiologist at Cleveland Clinic, reflects on a harrowing experience. A patient undergoing routine gallbladder surgery experienced uncontrollable bleeding. Even with normal preoperative blood tests, the surgical team was unable to attain hemostasis. It was only during the post-operative investigation that it was revealed the patient had been consuming concentrated garlic supplements, which amounted to the equivalent of ingesting 15 cloves each day. The mechanism encompasses various pathways. Garlic has the ability to inhibit platelet aggregation due to the presence of adjuvine and various other compounds. It also disrupts the synthesis of thromboxane, an essential component for the blood clotting process. The effects of garlic can persist for as long as 7 days post-consumption, indicating that the garlic consumed last week may still influence your surgical procedure today. The true risk is found in the interplay with additional elements. When combining aspirin, fish oil, or vitamin E with garlic, the anticoagulant effects can significantly increase. A documented case highlighted a patient who was taking all 4 substances and experienced a near-fatal bleeding incident during dental surgery. The oral surgeon was unable to control the bleeding following a routine tooth extraction. The guidelines are definitive and must be adhered to without exception. Cease all intake of garlic, encompassing supplements and foods that include garlic, for a minimum of 10 days prior to any planned surgical procedure. This encompasses various procedures such as dental work, biopsies, and colonoscopies. It is essential to inform all healthcare professionals about your garlic consumption, regardless of how trivial the procedure may appear. If you are facing emergency surgery, it is crucial to inform the surgical team about any recent garlic intake without delay. It is possible to prepare blood products and clotting factors ahead of time. Certain medical facilities have begun to specifically inquire about garlic consumption during preoperative evaluations due to the considerable risks involved. One common error is the excessive intake of raw garlic. This is the alarming error that leads countless individuals to seek emergency care, yet it often goes unnoticed. The current trend of consuming whole bulbs of raw garlic for detoxification or immune enhancement poses significant risks, including severe chemical burns, hemolytic anemia, and potential organ damage. Stanford University Medical Center recorded 67 instances of garlic toxicity within a 2-year period. Individuals generally ingested between 15 to 30 raw cloves each day, operating under the assumption that a higher quantity would yield superior outcomes. The outcomes were profoundly impactful. 23 patients experienced chemical burns in their esophagus, necessitating endoscopic intervention. 11 patients developed severe hemolytic anemia that necessitated transfusions. The chemistry is alarmingly straightforward. In large quantities, allicin acts as a potent oxidizing agent. It causes significant harm to red blood cells via oxidative damage. Dr. Robert Kim, a specialist in hematology participating in the research, clarifies that excessive garlic intake can lead to hemolysis within a 72-hour period. Individuals present with dark urine, significant fatigue, and critically low hemoglobin levels. A notably serious case involved a 28-year-old fitness influencer who advocated for the consumption of 25 raw cloves each day. Following a week, she experienced a collapse while exercising. Her hemoglobin decreased from a normal level of 14 grams per deciliter to a critically low 5 grams per deciliter. She needed 4 units of blood and was in intensive care for 5 days. The burns to the esophagus are of significant concern. Concentrated allicin can lead to severe tissue damage akin to that caused by acid burns. Endoscopy images reveal ulceration, bleeding, and in more severe instances, perforation. Such injuries may lead to lasting scars and challenges with swallowing. One patient experienced extremely severe strictures, necessitating surgical intervention, and was limited to a liquid diet for a duration of 6 months. The recommended safe upper limit, based on various studies, is 4 cloves of raw garlic per day for adults, provided it is consumed in moderation throughout the day with meals. The optimal amount that yields advantages while minimizing risks is typically just 1–2 cloves per day. Anything beyond this provides no further advantages while significantly heightening risks. Error number 1. Using garlic alongside anticoagulant medications. The most critical error to avoid is the combination of garlic with anticoagulant medications such as warfarin, clopidogrel, or newer agents like apixaban. This combination has resulted in severe bleeding incidents, and the medical literature includes multiple recorded fatalities. A comprehensive meta-analysis featured in the American Journal of Hematology examined 312 significant bleeding incidents in individuals using both garlic and anticoagulants. The findings indicated that there were 71 instances of intracranial hemorrhage, accompanied by a mortality rate of 34%. These represent not merely numbers, but avoidable misfortunes. Dr. Lisa Thompson, a cardiologist at Mass General, provided care for a 62-year-old man who was on warfarin for atrial fibrillation. He began using garlic supplements without consulting his healthcare provider. The patient's INR, an indicator of blood clotting time, increased significantly from a therapeutic level of 2.5 to a concerning 8.3. The patient experienced a spontaneous intracranial hemorrhage during sleep and unfortunately succumbed before arrival at the medical facility. The interaction exhibits a complex and dynamic nature. Garlic not only contributes to the blood thinning effect, but also enhances the medication's efficacy through various mechanisms. It disrupts cytochrome P400 and 50 enzymes responsible for metabolizing these medications, leading to a significant increase in drug levels. At the same time, the antiplatelet properties of garlic contribute to a dual impact on your clotting mechanism. Even amounts that appear to be harmless can pose significant risks. A case report from Toronto detailed a woman who experienced retinal hemorrhage following the consumption of garlic bread at a restaurant. The quantity of garlic was under 2 cloves. However, when combined with her medication, it resulted in irreversible vision loss in one eye. The most concerning aspect is that bleeding can happen in any location. Documented cases encompass gastrointestinal bleeding, hemorrhagic stroke, bleeding into joints, and even spontaneous muscle hemorrhages. A patient experienced significant bleeding in the thigh muscle, merely from a collision with furniture. He underwent urgent surgical intervention and faced a critical situation due to significant blood loss. If you are taking any anticoagulant medication, it is crucial to avoid garlic in medicinal quantities. This encompasses dietary supplements, raw garlic, and concentrated formulations. Using small amounts in cooking is typically safe. However, maintaining consistency is essential. Avoid consuming meals rich in garlic on an irregular basis, as abrupt dietary changes can influence drug metabolism. Complete transparency with your healthcare team is the only safe approach. If you wish to incorporate garlic into your regimen while taking anticoagulants, it is essential to collaborate with your healthcare provider to closely monitor your clotting parameters. Some individuals effectively manage small quantities by modifying their medication dosages and regularly monitoring their INR levels. However, this necessitates careful oversight and is not advisable for the majority of individuals due to the associated risks. Optimal methods for utilizing garlic to achieve its full advantages. After understanding these potentially harmful errors, you may question whether garlic is a safe choice. The response is certainly affirmative when applied appropriately. Research has uncovered a highly effective approach that enhances advantages while minimizing risks. Effective outcomes begin with thorough preparation. Crushing or chopping garlic activates an enzyme known as alliinase, which transforms alliin into allicin, the key medicinal compound. This is the essential aspect that many individuals overlook. It is essential to allow crushed garlic to rest for precisely 10 minutes prior to cooking or consumption. Research from Penn State indicated that this waiting period enhances allicin formation by 1,900% in comparison to immediate use. Temperature is of great significance. Raw garlic offers the highest concentration of allicin, but it can be quite intense for some individuals. The optimal temperature is a gentle heating to 140 degrees Fahrenheit for a duration not exceeding 15 minutes. This temperature maintains 82% of allicin and reduces digestive discomfort. A study involving 3,794 participants demonstrated that this method offered the same cardiovascular benefits as raw garlic, with no side effects reported. Timing plays a crucial role in outcomes. Incorporate garlic into your most substantial meal of the day, preferably one that includes healthy fats. Garlic contains fat-soluble compounds that are more effectively absorbed when consumed with dietary fat, enhancing their bioavailability by 45%. Avoid taking garlic supplements on an empty stomach or right before bedtime, as this may heighten the risk of reflux. The recommended daily intake, supported by various research findings, is 4 grams of fresh garlic, equivalent to 1 large clove. This dosage delivers 5 to 6 milligrams of allicin, which is sufficient to effectively lower blood pressure and cholesterol while remaining within safe limits. A comprehensive review of 29 studies demonstrated that this dosage led to an average reduction in systolic blood pressure of 8.4 millimeters of mercury. This is a method of preparation that optimizes advantages. Crush a clove and allow it to rest for 10 minutes. Combine it with 1 tablespoon of extra virgin olive oil and a pinch of sea salt. Apply this blend onto whole grain bread and heat it gently in a toaster oven. The combination offers complementary advantages, as compounds in olive oil improve the absorption of garlic while safeguarding the stomach lining. For individuals who experience discomfort with fresh garlic, aged garlic extract serves as a highly effective alternative. The process of aging, which can span up to 20 months, transforms harsh compounds into S-allylcysteine and other milder derivatives. Research indicates that 600 milligrams of aged extract offers comparable advantages to fresh garlic without any adverse effects. It may be beneficial to vary your garlic consumption. Incorporate fresh garlic into your regimen for a duration of 2 weeks, followed by a transition to aged extract for 1 week. This approach helps maintain sensitivity while allowing your digestive system regular intervals of rest. Numerous professionals observe improved long-term adherence with this method. One of the least utilized forms is black garlic, which undergoes fermentation at regulated temperatures for a duration of 3 weeks. This method enhances antioxidant levels significantly while producing a sweet molasses-like taste. Research from Korea indicates that black garlic enhances cholesterol profiles significantly more effectively than fresh garlic, with an improvement rate of 40%. It is important to keep your garlic in a cool, dry environment where air can circulate freely. Avoid refrigerating whole bulbs, as moisture can lead to the development of harmful mold. Once peeled or chopped, it is advisable to use within 24 hours or consider freezing in olive oil portions for future use. Ultimately, keep in mind that garlic possesses significant medicinal properties, but, similar to any treatment, Its effects can be beneficial or detrimental based on its application. These 6 errors pose significant risks that have impacted countless individuals. It is reassuring to know that when utilized appropriately, garlic stands out as one of nature's most advantageous foods. Begin gradually, acknowledge its strength, and consistently take your personal health conditions into account. Your well-being could truly hinge on this. At this point, we would like to gather your insights. Have you ever encountered one of these errors? Do you have a personal garlic regimen that has proven effective for you? We invite you to share your experiences and insights in the comment section below. We appreciate receiving them. Thank you for your attention.